Ben Edwards is a typical young boy. Yet in the spring of 2011, Ben faced a challenge that was anything but typical.
It was April 18th, 2011, and he was diagnosed with a brain tumor. The test that they ran determined that this was an ependymoma, which is a rare brain tumor. When I would read studies on these types of tumors, 10 years ago, kids didn't make it.
Following surgery, Ben visited the Indiana University Health Proton Therapy Center, where he received an alternative to radiation treatment.
Proton therapy is a unique form of radiation oncology. Conventional radiation comes in one side and goes right out the other. With proton therapy, we're able to stop the beam, and using devices called apertures and compensators, we can shape the beam three-dimensionally to within 1.5 millimeters of accuracy. If you've got a tumor near a critical structure where you need accuracy, proton therapy is ideal.
Proton therapy starts with the separation of hydrogen gas into protons and electrons. The protons are accelerated to 60% of the speed of light and then fed to treatment rooms where a narrow beam is carefully guided to attack the infected area of a patient.
Ben is alive because of this option. He is healthy. He has no cognitive impairments because of this proton therapy option.
Proton therapy is also used to treat other types of tumors. Spencer McKinney traveled from Cincinnati, Ohio to the IU Health Proton Therapy Center after being diagnosed with prostate cancer.
Proton therapy in and of itself provided me to continue with a good life, an active life, and most importantly, a normal life.
McKinney is not alone, as the Bloomington facility functions as a beacon of hope for many throughout the Midwest.
Since we've opened, we've treated approximately 2,000 patients, and about 80% of them come from states where the Big Ten lives and breathes. We have treated people who were told they had no other options. It's an honor to work with these patients, to see them every day, to be part of their lives. When you hear about a family member or friend who's got brain cancer, mention protons. When you hear about a child with any cancer, mention protons, because we can make a difference.